Hello everyone, my name is Favor Osakwe. I'll be discussing an effective evidence-based research method to prevent suicide. We are all familiar with what suicide is, but what exactly does it involve? Well, suicide is an intentional act resulting in one's own death. In general, suicide is an act of desperation brought on by an inability to cope with life stressors. Here in the United States, CDC recorded about 45,000 deaths to suicide in 2016, making suicide a leading cause of death. As you can see on the map, the whole United States is affected by this crisis. CDC also shows that in 2016, 9.8 million adults seriously thought about committing suicide, while 1.3 million adults attempted suicide. These numbers are very alarming. Risk factors for suicide include psych diagnosis of mood disorder such as anxiety, depression. This issue is very important because suicide is the fifth leading cause of death for children and the 10th leading cause of all deaths in the United States. What are the red flags? Well, some suicide warnings include talking about feeling trapped or in unbearable pain, talking about feeling hopeless or having no reason to live, increasing the use of alcohol or drugs. This topic is a matter of urgency because every 12 minutes, someone in the US takes his or her own life. And for every one suicide, there are 25 attempts. Thousands of people who committed suicide visited the ER seeking for help, but somehow, unfortunately, they were missed. Is there a solution? In case you're wondering, the answer is yes. Suicide is preventable. It requires access to effective evidence-based treatment through psychotherapy, and that is how we arrived at motivational interviewing. Is motivational interviewing? Well, it consists of a skilled style of counseling for enhancing natural motivation to change by exploring and resolving ambivalence. It involves brief individual meetings with the patient. It is patient-centered and it encourages reflective listening and open-ended questions. It includes showing empathy. The goal here is to reduce or minimize resistance. Motivational interviewing is a talk therapy that reinforces the patient's sense of self-efficacy and focuses on building patient motivation. Patient is primarily responsible for change. The provider guides and supports patients. The difference between motivational interviewing and cognitive behavioral therapy. In cognitive behavioral therapy, skills are built while motivational interviewing builds motivation. In CBT, solutions are pre-selected, while in motivational interviewing, patient picks solutions for themselves. So I did some research like everyone else, and I came up with 6 evidence-based practice research that support the use of motivational interviewing. The first evidence, here the researchers included 151 participants from 2 different hospitals, ages 13 to 17, who were hospitalized for psychiatric disorders. And they found that first, the research examined the effectiveness of motivational interviewing on behavioral change to the use of substance among adolescents with mental health diseases. And the result shows a significant reduction in the number of substance use, such as marijuana, within the first 6 months. The second research evidence, here the researchers conducted the research using a quasi-experimental method, which included a convenient sample of 120 participants, and they investigated MI and its impact on hospital readmission, length of hospital stays, general functioning, and satisfaction of people with mental health diseases. They found that MI can enhance and facilitate prevention of suicide. It is very effective in improving health care outcome with patients diagnosed with mental health problems. Third research evidence, here the researchers examined the efficacy of MI in pediatric and adolescent population in promoting treatment adherence rate and also the increase of follow-up attendance after inpatient admission. The researchers found that convincing evidence support the efficiency of MI as a treatment tool for healthcare providers to enhance outpatient appointment attendance rate. The next research evidence, here, they focused on MI intervention among adolescents patients with anxiety and mood disorders in enhancing treatment engagement. The result shows that participants who receive motivational interviewing intervention demonstrated higher treatment initiation, and the ratings of treatment readiness were significantly higher than the control group. The next evidence, here the researchers evaluated the effect of positive group psychotherapy and motivational interviewing as an intervention for smoking cessation. The researchers found that participants reported that motivational interviewing increased their motivation to stop smoking. The last evidence I have for this presentation was conducted in 2016. Here, they investigated how to generate increased exploration of motivational interviewing for suicidality. The result was also positive. Motivational interviewing allowed clinicians to quickly assess suicide rate, suicidal risk, and arouse motivations and protective method of preventing death. What are the recommendations from all these researches? Well, quite a few. Some of the recommendations include the application of motivational interviewing into practice. A lot of the research actually encourage clinicians to use this tool effectively. Motivational interviewing, we are encouraged to use it in any clinical practice, whether it's primary care or specialty, to prevent. More recommendations include using MI as a promising intervention to facilitate engagement in adolescents suffering from mental health disorders. Given the flexibility and strong practical support of MI, the researchers recommended that clinicians should adopt the tool in assessing potential suicidal patients. Motivational interviewing should be implemented in future. What are the benefits? Well, in summary, it is patient-focused. It enhances the patient's sense of self-efficacy. Practice implications for psych nurse practitioners. First, early and proper screening and assessment is very, very important when it comes to suicide prevention. Encourage patients not to hold back or feel embarrassed to seek help. Clinicians should be non-judgmental in order to enhance accurate diagnosis. Nurse practitioners should incorporate these findings into their practice. And always remember, medication is not the first line. The first line of treatment for suicidal patients is psychotherapy, and that is how we come to motivational intervention. Motivational interviewing has shown significant effectiveness when used with other therapies such as medication. It is quickly assessed by. It is very easy to use and it enhances holistic care. Motivational interviewing has great potential to reduce the rising rate of suicide. Motivational interviewing is an evidence-based tool, highly supported and recommended by reputable research. Motivational interviewing has shown to be the most effective and efficient tool in preventing and reducing the rate of suicide. And so everyone is encouraged, every provider is encouraged to use this tool effectively and frequently to reduce or prevent suicide. Thank you everyone for listening to my presentation. I look forward to your feedback.